Although it may not have the top spot among B vitamins numerically, vitamin B12 plays a crucial role in maintaining our overall health and energy. According to renowned health expert Dr. Fred Pescatore, vitamin B12 deficiency is more prevalent than we might think, affecting around 2/3 of the population to varying degrees. This deficiency can stem from a diet lacking in essential nutrients, certain medical conditions, or commonly prescribed medications. Moreover, as we age, our ability to absorb B12 decreases, making women over 50 particularly susceptible to this shortfall. Are you curious about whether your B12 levels are sufficient? Let's explore the typical B12 levels for different age groups and what steps you can take if your levels need a boost. The importance of adequate B12 levels. Vitamin B12, also known as cobalamin, is vital for the production of red blood cells, maintaining a healthy nervous system, synthesizing DNA, and converting food into energy, explains Laura Binder, LAC, of Santa Monica Acupuncture and Wellness. Additionally, Dr. Pescatore points out that B12 helps regulate homocysteine levels, an amino acid linked to an increased risk of heart disease. Symptoms of vitamin B12 deficiency. Dr. Lee Erin Keneally, medical director of the Center for New Medicine, lists several signs of severe B12 deficiency, including numbness, burning, or shooting pains in the extremities, difficulty walking or poor balance, glossitis, a smooth, red, and painful tongue, shortness of breath and or heart palpitations, memory loss or mood changes, and megaloblastic anemia, abnormally large red blood cells. However, Dr. Keneally cautions that milder B12 deficiencies can also cause symptoms such as fatigue, brain fog, mild depression or irritability, and tingling sensations in the hands or feet. Dietary B12 levels by age. Since our bodies cannot produce B12 independently, we rely on external sources like animal products and B12 supplements. The National Institutes of Health, NIH, recommend the following daily dietary B12 requirements based on age and life stage. Infants birth to 6 months, 0.4 mcg. Infants 7 to 12 months, 0.5 mcg. Children 1 to 3 years, 0.9 mcg. Children 4 to 8 years, 1.2 mcg. Children 9 to 13 years, 1.8 mcg. Teens 14 to 18 years, 2.4 mcg. Adults over 18 years, D12 mcg. Pregnant women, 2.6 mcg. Breastfeeding women, 2.8 mcg. Blood levels of B12 by age. A simple blood test can determine your B12 levels. Although doctors don't routinely screen for B12 deficiencies during regular checkups, they may order tests if you exhibit symptoms of low B12. Normal B12 blood levels may vary slightly between labs due to different testing methods, but Yale University experts suggest the following guidelines. Normal B12 level, above 300 pgm per milliliter. Borderline low B12 level, 200 to 300 kgm per milliliter. B12 deficiency, below 200 pgm per milliliter. However, it's important to note that a blood test only measures circulating B12 levels, not how much is being utilized by the body. Dr. Keneally suggests checking methylmalonic acid MMA and homocysteine levels for a more accurate assessment of functional B12 deficiency, where the cells are unable to effectively utilize the available B12. Causes of vitamin B12 deficiency. As we age, our stomach acid production naturally decreases, which is necessary for proper B12 absorption. Consequently, reduced stomach acid becomes the primary cause of diminished B12 absorption after the age of 50. According to Binder, research published in the Journal of the American Medical Association reveals that long-term use of acid suppressors, such as H2 blockers and proton pump inhibitors, PPIs, can hinder B12 absorption, increasing the likelihood of deficiency. Other factors contributing to B12 deficiency include medical conditions like pernicious anemia, celiac disease, or Crohn's disease, bariatric or stomach surgeries, prolonged use of the diabetes medication metformin, and vegetarian or vegan diets. Boosting your B12 levels. Dr. Pescatore advises consuming 2 to 3 servings of B12-rich foods like lean beef, chicken, salmon, eggs, and Greek yogurt daily, unless you follow a strict plant-based diet. He also recommends a baseline supplement dose of 1,000 milligrams of methylcobalamin, a biologically active form of B12, per day. Sublingual supplements, which deliver B12 directly through the blood vessels under the tongue, can be beneficial for individuals with gastrointestinal absorption issues. However, the ideal dosage can vary depending on the severity of your deficiency. It's wise to consult your doctor to assess your B12, MMA, and homocysteine levels. Based on the results, your healthcare provider can guide you on appropriate dosage adjustments or alternative treatments, such as B12 injections. Remember, this information is not intended to replace professional medical advice or diagnosis. Always consult with a qualified healthcare professional before starting any treatment plan.